Can you say hi? Can you say hi?
Hi, Mommy. Where's Mommy?
Hi, I'm Jenny Smith, and this is my daughter. What's your name?
Peyton.
This is Peyton Smith. She was diagnosed with biliary atresia at 8 weeks. She had a Kasai and then had liver transplant. Can you stand on this chair? Hold on. Come here. I want you to show them something. Can you show them your rainbow? Where's your rainbow? Right there. So Peyton's liver transplant was right here. Where's your liver? Where's your new one?
No.
Right here? Right here. So the main medication that your child's going to be on for life is tacrolimus or Prograf or Rapamune. It's the immunosuppressant. You're going to be taking it in 12-hour increments. So we take ours at 9 a.m. and 9 p.m. It's really important to take the medication right on time because the 12 hours of coverage ends, and if you're late, that gap, even if it's 15 minutes, it's 15 minutes that your body isn't covered and your body could start attacking the organ because it doesn't think it belongs there. It is a medication that they're going to take for life. I know there's some trials going on right now of kids who have been transplanted very early, who have been weaned off Prograf or Tacro, and they're doing just fine and they're not going into rejection, but that's still in the works in terms of research. So one of your biggest priorities is going to be making sure that you have enough of the immunosuppressant on hand for your child to make sure that they get every dose that they need, that you're not missing any doses. Typically you need to order your meds 5 days before you're going to run out. That gives you a little leeway time in case there's a shipping issue or maybe they've run out of it or it takes longer to compound than they thought it would. It's really important to do it again 3 to 5 days beforehand because it does take up to 2 days to compound the medication. Also check with your insurance and make sure that everything is set up correctly so that you don't have a missed dose as well because you're waiting on someone to fix the paperwork. That's really frustrating. So again, it's just really important that they don't miss any doses. Okay, a big part of your life post-transplant is getting lab work done. Right after transplant, you're going to go every week and then maybe every 2 weeks and then maybe every month and then maybe every 3 months. But it's really important to get there right on time. If you take your meds at 9 and 9, that means you're going to be at the lab getting the labs drawn at 8:30. So it means you really have to get there at 8 a.m. So it's really important that you be there on time. Lab results really drive your child's care. So it's important that you're there on time because the lab results are going to be able to make sure that the dosage that your child is recommended for is exact. So the better labs that you have, the better the treatment is going to be for your child. Okay, it's really important to get flu shots. Everyone in the family or anyone that's going to be in contact with your child really needs to have the flu vaccine and not the flu mist. The flu mist is actually a live virus, so your child can't have that, and they actually can't be around anyone who's had the flu mist. They can't be around them for 2 weeks. Getting the flu shot is really a good preventative measure, but it doesn't mean that you're not going to get the flu. Peyton had her flu shot this year and she did have flu, but her symptoms were much less severe than they would have been if she'd not had it at all. So it's just really important when you get that call or that card in the mail that says go get your flu shot, make sure you go. Okay, so when you come home from the hospital, you're going to be wanting to get everything ready in your house to get your child ready to come home. There's a couple of things that you're going to want to avoid picking up at the grocery store. So you're going to want to leave out grapefruit and star fruit and pomegranate. Whole fruit like star fruit and The grapefruit can actually make the prograf level in your child's body increase to dangerous levels, and it can be very dangerous for the kidneys. You're also going to want to watch out for like mixed fruit juices, like pomegranate juice, even things like Capri Suns, like fruit punch. Sometimes you're not really sure what's in it. So when you go to different events or gatherings or parties, it's really important to just kind of look around and see what they're serving, and if they are serving that item, just to let the people know around you that your child can't have that and they shouldn't share with her. So just simple things like that, but that you want to keep them out of your pantry. Okay, one thing that the Tacro does is make your child more sensitive to sun. So it's going to be really important to always wear sunscreen. If you can find a baby lotion that has sunscreen in it, that's really helpful because you can wear it every day. I like to have a hat in her bag with me just in case it's bright and we weren't anticipating being out in the sun. Additionally, you want to continuously flush out those kidneys, so have a water bottle at the ready at all times to keep them really hydrated, to help them be healthy. Okay, so post-transplant with your child being on an immunosuppressant like tacrolimus or Prograf, you're going to want to make sure to have the right kind of fever reducer on hand. So in your mind, you're probably going, which should I use, Tylenol or Motrin? So the Prograf is really rough on the kidneys, and so is Motrin. So you want to give your child's body a break and use Tylenol instead. So remember to use Tylenol, not Motrin.